Hi everybody, Dr. Erica here. I hope you're having an awesome evening. Here I am in my basement. No office here, it's just you and me. To start off, I think it's always nice to do a little introduction. I hope you'll introduce yourself too by sending me a message from time to time and also asking questions. I'm Dr. Erica Statman, and I'm a graduate of Manhattanville College, where I got my bachelor's degree in psychology. I also am a graduate of Parker University in Dallas, Texas, and I have a diplomate from the International Council on Chiropractic Pediatrics. I have a certificate in acupuncture, and I am a lifelong student of applied kinesiologies. I own and operate Maimonides Chiropractic here in Fairfax, Virginia. A lot of people want to know, what is Maimonides? Maimonides is not my creation by any means. Maimonides was a Jewish scholar and physician who was born in 1135 in Spain and died in 1204 in Egypt. He was also known as Rabbi Moses ben Maimon, and we know him as Maimonides. And he was one of the most prolific and influential Torah scholars of the Middle Ages. He was also a physician, which is the part that really interested me about him. And he is known for many, many pieces of work, but one quote you might recognize by him is, if you give a man a fish and you will feed him for a day, if you teach a man to fish, you will feed him for a lifetime. So I hope that the information that I'm going to share with you this evening will feed you for a lifetime, but will also just be a starting point for your own better health and that of your family. When I did a poll to find out what everybody wanted to hear about, one of the most overwhelming answers was allergies. And I'll tell you what, in Fairfax this week we're having an air quality alert, and people are really feeling it with allergies. Lots and lots of symptoms. So we couldn't have timed this talk better. Before we get into treatments and things of allergies, which I'm sure you're eagerly looking forward to, as am I, a little background, I think, about allergies is a smart way to go. I really do believe in an integrative approach, meaning different disciplines and treatments that complement each other rather than competing. The Asthma and Allergy Foundation of America says that allergies are one of the most common chronic diseases, and it's a disease that lasts a very long time, sometimes over a lifetime. And it happens when the body's immune system sees a substance which is normally inert as something harmful and overreacts big time. And those things that we react to are, or those responses that we have, are called allergic reactions. And we produce an antibody called immunoglobulin E. So the symptoms almost everybody is familiar with, or mostly, and that's, the simple stuff like watering eyes and runny nose and sneezing and rashes or hives, or even more severe reactions like anaphylaxis, which is very serious, the most serious. The most common allergies are to things that are in our environment very regularly, which is kind of why it is difficult to get on top of some of these things, because you just can't get away from things like pollen, trees, grass, weeds, mold, foods sometimes if you don't know you're sensitive to them. Pet dander, as much as we love our animals, they are a major source of allergies. And so sometimes we know what causes it, right? My son, if he gets a hold of a peanut, God forbid, we know right away, right? Because he has tearing of the eyes, he has tons of mucus coming out of his nose, he vomits. I mean, that kind of allergy we know all about. It's very easy to spot. But actually a lot of allergies aren't so easy. So as we've moved forward with our understanding of allergies, we also see that we've kind of relaxed the definition of what an allergy is. And we're going to talk about this in just a moment. So testing for allergies is a big deal, right? We find out that somebody has an allergy and we want to know what caused this. The Journal of Medical Review says the proper way to diagnose allergies is, number one, by a personal and medical history. The more information you give the doctor, the better. Number 2, a physical exam, so looking at eyes, ears, nose, throat, chest, pulmonary exams, even an x-ray of the lungs to rule out things like asthma, for example. Excuse me. There are also other tests, like the famous skin pricking test. Nobody likes the skin prick test because it hurts, right? You can have multiple tests of different allergens that are actually put under the skin, and you wait for a response, like a bleb that becomes inflamed and red and spreads and so forth. Dean Metcalf of the National Institute of Allergy and Infectious Disease, that this kind of testing is probably dependable in diagnosing allergies to airborne materials, like the pollens and molds and things we're having right now, but not so hot for foods. But interesting, I find with my patients, and maybe this has been your experience, I find that they test for foods this way all the time. Why isn't it necessarily the best test for foods? Well, the way we experience foods is through our digestive system, right? So the idea that we could somehow put this under the skin and get the same response, not as reliable as we would like. So that's one of the limitations of this kind of testing. Another limitation is that you can have a whole bunch of false positives on these tests, meaning that it says that you're having a reaction when really you don't have an allergy. So it's not always so clear with this testing. There are also patch tests and blood tests and things to help us get a larger picture, and also the RAST test, R-A-S-T, RAST. Lots of false positives is one of the limitations of this. And it also doesn't tell you the severity of the allergy too. Just because you have a big response doesn't mean you're going to have a big allergic response or lots of severe symptoms. So one of the things that they also talk about being a limitation of the RAST test, by the way, is another important thing I want you to understand when you go for this testing, which is it lacks universality, which means only about 25 or 30% of food allergies are mediated by an IgE response. So if all you're measuring is IgE, you may not catch a whole bunch of these allergies. Get it? So when you go for these tests, remember we're getting a snapshot for as much as we can possibly look at that time, but it's by no means a full picture. We have to look in several ways. Another couple of limitations too, by the way, is that it's expensive. And number 2, you have to eat foods that you suspect you're allergic to within 48 hours of the test, which is kind of problematic because if you're pretty darn sure that you're allergic to it, you're going to feel bad, right? So this isn't probably the best test for somebody who has a severe allergy because it could really harm their health or put them into anaphylaxis, God forbid. So, perspective is important. There are also leukocytology tests that are available where allergens are actually added in vitro to whole blood or serum leukocyte suspensions, and they look for reduction in white blood cell count, the death of the cells. It doesn't correlate so well with skin tests in many cases, and 30 years ago there was really a lot of criticism about the leukocytology tests. Today there's been more research on this, and it is possible that maybe we're seeing better and more specific results because we can actually divide things out between positive or helpful antigens versus negative antigens. In fact, my friend Dr. Carmel Wiseman, who I want to give a shout out to, we were just discussing this today, and she may tell you more about that later. There are also sublingual provocative tests where you actually take some of an allergen and you put it on your tongue and you wait to see what happens. This is more of a clinical practice and not so hot as far as the research is concerned, but that doesn't mean it doesn't work either. Just because we don't have loads and loads of research doesn't mean it might not be helpful. The bottom line that I want everybody to get is that no single test is a gold standard, ever. The skin prick testing is often, I think, presented to our patients that way, and it's really not. It's only moderately reliable according to the Journal of Allergies' own assessment. But for them, it's the best thing to have. And I think sometimes I really wish they would go further looking at this from a more complementary perspective because I think it would give patients more choices. So after all this testing, let's say you get lots and lots of testing, it all comes down to treatment, right? So conventional treatment kind of goes like this. There are nasal corticosteroids like nose sprays, antihistamines that block, histamine, and this is good for sneezing and itching and runny nose and hives and things like that. There also are mast cell stabilizers that keep your body from releasing histamine in the first place. There are also decongestants to relieve stuffiness and to shrink the swollen membranes in the nose. But you have to be careful because when you use these sprays, by the way, it can cause even more swelling and actually even sometimes bleeding from the membranes. The nose sprays are like that too. There are also corticosteroid creams and ointments, oral corticosteroids like prednisone, epinephrine that are used like in the EpiPens you've heard of. Great drug, an EpiPen, right? Saves lives, no question. But one of the things that is global of all these things is that they do not find the cause and treat the cause of why the person has the allergy in the first place. Now, chiropractor, are you saying that these drugs are bad? Check it out. I'm not saying they're bad. Really. We need medications. They're important. But all I'm saying is we need to look a little more deeply to find out what we can do to develop our health better so that these allergies will be minimized as much as possible or go away. Okay. By the way, these allergy drugs have lots of side effects. If you didn't know about them, look at the inserts on them, right? So, high blood pressure, sleepiness, like with Benadryl, that knocks me out. If I have to take a Benadryl, forget it. I'm sleeping on the couch, that's it. They contain dyes, like red dyes, which is terrible for a lot of kids. They cross the blood-brain barrier and make kids like crazy with their behavior sometimes. So it's like, hey, can you at least get us one that doesn't have any dye in it? I know that there are those available now, but that's an issue. Headaches, dizziness, nausea, vomiting, moodiness. That's a big deal in kids. So, we have kids who have tons of allergies, and you give them the medication to help relieve that, which is a good thing, but that in itself may even cause moods, right? Outbursts, sadness, happy one moment, very upset the next moment, and then it becomes hard to tell, what actually is the problem here. Is it the drug? Is it the allergy? Is it something else? Just because you haven't eaten in a few hours, who knows? So, but let's not stay on the dark side too long here. We look at these drugs. They're not only therapeutic, but check this out. This is the cool thing. Check it out. They can be diagnostic. Yeah. So if you have an allergic reaction, let's say, that improves with prednisone or corticosteroids, let's say, what does this tell you about the body that's having the allergies? If this thing really helps, what does it tell you? Well, one possibility is it tells you that that person's own cortisone-producing factory, which is actually called cortisol in the body, is low. So if we can help support the cortisol factory that our body makes naturally, perhaps we could reduce the overall inflammation of these allergies and help the body be more stable and healthy. Isn't that cool? Okay. So check it out. I want to talk to you a little bit about my deal here. I'm a chiropractor, obviously, and I can't prescribe drugs. Not in my scope of practice, and I'm glad, because you know what? They're far more talented and able people than me to do this kind of thing. So thank God I have my medical friends who can do this. But what I can do is help the human body do what it does better by helping its overall wellness and well-being. So, I use chiropractic adjusting in my office. If you're familiar with my practice at all, you know I do lots of different techniques. So some of them are like activator methods, which is instrument-led adjusting. Thompson, which uses a table with drop pieces. I use my hands. I do upper cervical specific, toggle recoil. I do applied kinesiology and TBM. I do all these different things. Why? Because not everybody is served by the same technique. I wish they were. It would make my life so much easier and everybody else's as well, but it doesn't work that way. I learn lots of things in order to be helping as many people as I can. Applied kinesiology and chiropractic enhances everything that we just talked about in terms of assessment and treatment of allergies, but also replaces nothing. Remember all these things can really work together. What do we do with these techniques? We can use specific techniques to help identify allergies and hypersensitivities based on the response of the nervous system. Wait, hold up. Didn't I just say this was an immune system thing? I did. You were paying attention, I promise. But when we're talking about chiropractic, we're looking at a different system that actually runs the immune system, and that is your nervous system. Without the nervous system, forget about it. Nothing else works. So how do you do this? How do you look at the immune system with the nervous system? Well, one technique, not the only technique, so relax, one technique is to use manual muscle testing, or what's also called muscle response testing, MRT. What we do is we use this to help identify how the immune system is working through the nervous system when we have a noxious substance applied. So, let me break that down. A muscle test is we find, I'm going to just use my arm as an example, a clear responsive test. So I might come over and test this deltoid and see if it's strong when I press on it. Now I wouldn't do it to myself, I'd be doing it to a patient. I don't have a model here, so I'll have to be your model tonight. So anyway, if I press on my patient's arm like this and I get a strong muscle response, that's an appropriate response. Now, if I was allergic to something, I'm just going to use this as an example. I'm not really allergic to this. This is my son's merit badge. But I can take this thing that I suspect I might be allergic to and put it on my body, or even better, put it in my mouth and taste it, and at the same time muscle test. And if really that thing is noxious to me, I'm going to produce a weak response. Really? Isn't that cool? It really is cool. I'm going to just tell you that muscle response testing is a technique that takes skill. Really. I've been doing this a long time. I actually started studying muscle response testing since I was about 15 years old, and I've been doing it since then. So I got like 30 years of doing this, and I'm still learning things. The test is only as good as the doctor creates the situation to be. There has to be proper technique, there has to be a willing and capable patient, the whole 9 yards. So just know this is important. Once we get this weak muscle due to a noxious stimulation like a food or an airborne allergen of some kind, then we can look to see what the body needs in order to be better balanced. Does it need better lymphatic drainage? Does it need vascular stimulation? Does it need an adjustment? Does it need nutrition? Does it need all these things? How about acupuncture or meridian therapies? That's another possibility too. And so you can challenge the body in different ways, using different reflex points, touching different vertebrae, different phases of respiration to find out what you need to do to actually help the body to be at peace in the presence of this thing, whatever it is. Okay. And the nice thing about applied kinesiology, is that it can include, it doesn't have to just include natural stuff. It can also include over-the-counter meds, nutrients, and the suitability of the current drug regimen. Now, by the way, we don't test prescribed medications. Not ever. Not my job, not in my scope of practice. But we could look at the medication together and say, hey, maybe this is something you need for now. Let's keep checking in with your medical doctor to see if you keep on needing it, or if it's something maybe we can have less of, or more of, for that matter. So this is about working together with our colleagues. So another benefit of muscle response testing is that it improves the likelihood of a positive response to therapies, right? And ideally, it helps the immune system to self-repair. That's really what we want, right? Because it's, you know what? The difference between taking a Benadryl and taking a natural histamine blocker, they're both allopathic, right? All they're going to do is lower inflammation, block histamine, any of those things, but it doesn't really cause self-repair. To me, the big goal, my eyes are on the prize of helping to resolve this. Can we do it 100%? The truth is I don't know. I really don't know. There's no guarantee of these things, but that's always what I hope for. When does this not work? Because like everything, not everything works on everybody, right? Well, there is some evidence to show that some allergies have a very strong genetic link, right? Back in 1964, in Applied Nutrition, they said that when there are generations of people who have a similar allergy, like let's say to wheat or gluten or something like that, the likelihood of the offspring having that same allergy is quite high. And in fact, you can test for it now, by the way. We have labs like Entero labs now. It's really awesome. You can actually get a cheek swab, meaning no pricking, which is great for kids. And they can tell you if your family has this genetic disposition toward things like celiac disease or wheat allergies or gluten allergies. And you know what? If you test both parents and both of them are positive, guess what? Your kids are too. And you can save some real money by doing it that way. Anyway, I'm sorry, I'm getting off the track. But the idea is that with genetic allergies, those are very difficult to get results with. It's difficult. But there was an interesting thing that Pottinger here, who wrote this Applied Nutrition, way back in 1964 found. That they took some cats, and I'm sorry, cat lovers, really, this is terrible, but ready, let's watch this. They took some cats, and they made their diet deficient in nutrients. Deficient in nutrients. Poor things. Anyway, and what happened was those cats started to become allergic to things, like humans. And those cats had kittens, and those kittens had kittens, and those kittens had kittens. And guess what? Those cats and those kittens, those offspring, also had allergies. So then, a few generations down the road, they started to feed these cats a diet which was better, that had all the things that cats need in order to be healthy cats. And you know what happened? Allergies continue to improve and improve and improve in their offspring. How cool is that? So even from this one little animal study, we know that it's possible to improve the health, not only our health, but God willing our children and our grandchildren, by changing our nutrition. So, anybody have a question? I'm going to just stop for a second here, and I hope I can read these. Please forgive me if I can't see. If anybody wants to send me a question or anything, please. I'm going to take a minute and just breathe. I'm going to have some tea. Anybody? I got an amen from Dr. Wiseman. Thank you, Dr. Carmel. You're awesome. Okay. Let's do it. Here we go. The first thing I want to talk about is like, how do we actually do this procedure from the perspective of AK? You with me? We're going to be testing cranial nerve 1. Cranial nerve 1. That tests the olfactory and gustatory system. How do you test it? You put something on the tongue, right? So first you find your, excuse me, your clear muscle test, and then you taste the suspected item, only if it's safe, by the way. If you know that you are super duper allergic to something, we would never do this because that would be unsafe. Or we could use the challenge on the skin for cosmetics, detergents, and so forth. Put it right on the skin, okay? Maybe we can put a little bandage on it, make sure it really sticks. And then we'll go back and test again. If it's weak, then that means there is something that your body really doesn't like about this, and that's what to work with. If it stays strong, no problem. We keep going. Now, in some systems, they'll hold a bottle or some kind of a substance on the body like this. In AK, they don't do that. Other systems do things differently, and that's fine, but I'm not talking about that particularly tonight. So you think, wow, this is so cool. If this actually works, my goodness, couldn't we save tons of money and stress and meds and all that kind of stuff? Well, it's true, and so we're trying to get the word out. But then a lot of people want to know, does this really work? Isn't there a lot that could really get in the way of proper testing? Absolutely. Absolutely. Remember, like any piece of technology, it's only as good as the person who is utilizing it, right? So we are still, just like all these other testing procedures, blood and skin pricking and all this stuff, we are still learning about the mechanism of these things. The same is true in regard to AK. So the folks at Applied Kinesiology recommend, Dr. Walters recommends, that we test these substances repeatedly to make sure that we got the right answer. Because just because you got a weak response the first time doesn't mean you're necessarily allergic to it, but it also doesn't mean that you aren't. So he recommends testing it several times, and he also recommends doing blind studies, meaning that instead of me knowing that, this is a egg or something, that I don't know what it is before I put it on the tongue, assuming this is safe to do, right? And so that the doctor's head is out of it, right? Like, just because I think you're really allergic to gluten, man, doesn't mean you are, right? So we try to test it in a blind manner if we can. Ideally, really, there should be a multifaceted approach, not just to rely on one way, right? Here's an interesting, oops, hang on, we have a question from Miss Sherry, hold on. Not really a question. She said that her son had a scratch test before 2 years of age, and blood test at 6, and were told no allergies. It wasn't until he had a horrible allergy season with hives that we had allergist tests and diagnosed positive for outdoor allergens. I wish we had been diagnosed earlier. Yeah, like there's this belief system that actually kids can't have allergies until a certain age. And I got to tell you something. I don't know about that. I'm not an allergist, okay? But I'll tell you what. I have kids coming in who are little babes in arms who are showing all kinds of allergy signs, all kinds. And not only are they allergy signs, but or symptoms, I really do think they're allergies because there are 2 or 3, even 4 siblings who have the same allergies. So I think to maybe comment on what Sherry's saying is that we may need to look at childhood allergies just a little bit differently. There's also another question here, which, Sherry, hang in there, my friend, because I'm going to answer that one as I get a little farther down. So hang on, I like your question. So, now, back to the muscle testing for just a second, okay? This is cool, because you know me, I like research. If you know me, you know I like to read. I do. So here's an example of how we know about this, a study about the efficacy, or the reliability, rather, of muscle testing. There was a research done by Schmidt and Leibowitz who wanted to see if the results of the AK muscle testing, how they lined up next to the RAS tests, which examined for IgE and IgG findings. The study was like this: 17 subjects, 17 people, and they tested for 21 foods that were found to have positive findings indicating allergies. 19 of the foods that were tested positive to AK's method, this, also showed positive blood tests. Isn't that cool? So check this out. The AK testing with this was very, very close to what the RAS test showed among people. Does this mean, boom, we're done and we don't research anymore? Of course it doesn't. We need to keep learning. But it does give us further evidence to say, hey, AK can be a really helpful tool here for looking at, or at least narrowing down, right, what a person may be sensitive to or allergic to. Let's see. There are more questions here. Some of them, are you discussing this? I love it. I love it, I love it. All right. Now, there's some other tests that are outside of AK. One is abstinence and reintroduction. So in other words, you think you're allergic to gluten? Don't eat gluten for a couple months and see how you feel. Sometimes that helps, right? If you take something toxic out of, or noxious out of your diet and you feel better, you go like, okay, I don't need to try that again, I'm good. And that can be helpful, but sometimes people's allergies are very complex, and it takes an enormous amount of work to figure out what you need to take out of the diet. And especially when you're talking about multiple sensitivities and airborne plus food, it gets really complicated. So it may help in the case where there are just a few allergies, but when you're talking about whole bunches of them, that becomes a lot more complicated. There's another test you can do at home. I like doing at-home things. You ready? There is Coca's pulse test, and what you do is you look at it for a change in your pulse after eating a suspected allergenic food. So you go ahead and eat your whatever, your gluten, your dairy, or whatever you're allergic to. Well, before that, I'm sorry, you take your pulse and you look at how many beats per minute you have. Then you take the food in your mouth and you look at it and you feel for the pulse again. And in fact, if you are sensitive to something, chances are your pulse is going to go up quite high. In fact, I know of people who have eaten foods they're allergic to who can feel their heart bounding when they eat something they're allergic to. Okay, so number next, let's see. Another thing is that AK and chiropractic also come together in regard to the mind-body connection. So AK, TBM, neuroemotional technique, all these kinesiologies have a part of them that is devoted to neutralizing emotional stress. Why is emotional stress important in regard to allergies? Well, stress, bad stress, kicks up your cortisol. It kicks up inflammation in your body. It causes a sympathetic overload, just like allergies do. So if you have even a phobia to a food, and you have anxiety about, like, oh, what if there's a nut in here? And by the way, my son knows this, right? Because he's afraid to go out and eat places. This is for real. So we try to be very safe. Accidents have happened, which is very scary. But after a while, a person could really develop a phobia or a fear of food or fear of all food. But either way, that stress, in my opinion, needs to be neutralized so we can decrease the inflammation and take, then further steps in the nutrition department. Okay. Next, let's get back to chiropractic here because that's what I do, right? Why do adjustments help with allergies? Really? I mean, allergies are like a chemical thing, right? It's an immune system thing. And adjustments are just for neuromusculoskeletal problems, right? Wrong! It's never been that way. Check this out. Your nervous system runs everything in your body. Really, it always will, from beginning to end, as Dr. James W. Parker, founder of Parker College of Chiropractic, used to say, from womb to tomb, right? So when we find that there are subluxations of the spine, which are misalignments of the bones that cause pressure and irritation to the spinal nerves, that also messes with our immune response. We've known about this for ages. I can say this now. Back in the early 80s, Dr. John Grostic, may he rest in peace, did a phenomenal piece of research. And he found, what he did was, he had people with HIV, right, the cause of AIDS. And he found, and he took two groups. Okay, one group got specific chiropractic adjustments to the upper cervical spine, just the atlas, that's it, nothing else. And the other group got nothing. And what they wanted to measure was the CD4 cells, which are responsible for immune capacity and suppressing the HIV virus. And what they found was that the group that got the adjustments had an increase in immune capacity by like 80% in some cases, and the people who didn't get anything didn't fare any better or worse. And in some cases, actually, they did get worse. The study was apparently replicated in Europe, I want to say Sweden, but it was canceled because the people who were getting Grostic upper cervical specific got so much better, and the people who didn't get anything at all got so much worse that they canceled the study and said, we can't do this, it's not ethical. We're going to have to treat everyone. How about that? So going to a chiropractor who's skilled in specific subluxation diagnosis, what makes an adjustment great are two things. Specificity to where the misalignment is, and number two, speed. Really. We don't want generalized manipulation of the spine. It messes with all kinds of structures and neurological things that are better left alone. You want to just focus on just the one subluxation. People sometimes ask, can you be over-adjusted? The answer is no, because the only reason that a chiropractor has to adjust anybody is if there's a subluxation present. If there isn't, they shouldn't be adjusting you. Got it? That's how it works, really. Now, also, by the way, when you adjust, you are also promoting better vascularity, better lymph drainage, better organ function, all kinds of stuff. Now, let's talk a little bit more about nutrition. I can see that everybody's like excited about nutrition. We want to talk about what honey is, local honey. So you can get honey in the grocery store, right? In the little bear and stuff. And that tastes really good, but it doesn't really help you with your allergies because there's no pollen left in it, right? That stuff is pasteurized, bottled, and sitting on that shelf for Lord knows how long. The difference between that and local honey is hopefully that you can get local honey that's not pasteurized, which is not easy to find, by the way, always, because there are regulations around that. But you want to be able to find one excuse me, that still has the pollen in it. By the way, if you go to Roberta's here in Fairfax, they have a bunch of this. I think Wegmans might too. Y'all probably have found places. Even your neighbors sometimes keep bees, and you should ask for it. So how do you use this? You take a teaspoon or so a day and put it on a rice cracker, or just suck it off a spoon. And if you do this all year round, it's going to help inoculate you against the pollens that are on the outside. So that's the thing about honey. I hope that answers your question, Sherry. Next, let's go to natural stuff. In our office, I have a number of things that we use to help control histamine, because sometimes people are just so sick that they don't want to wait for the whole process of doing all the AK and all that, and they just want to kind of get on by a little bit better, and that's cool. I'll tell you what I really love. I love homeopathy. Homeopathy is phenomenal. I use homeopathy from any number of sources. I happen to like Apex Energetics, which is available through physicians. If you don't have a physician or you're not my patient yet, you can go to the vitamin shop even, and there's a company called BioAllers. It has like a blue chevron on the box. They have awesome homeopathy. Homeopathy is nice because it's non-invasive to the body. It so rarely has a side effect that you almost don't even notice if you have it. And it's very safe. So when I talk about, giving this to pregnant mothers who also feel bad and have tons of mucus just from being pregnant, this stuff is really awesome. For people who have allergies to stinging things like mosquitoes and bees, assuming you're not anaphylactic, by the way, you can use homeopathic Apis, A-P-I-S. That works very, very nicely. For people who are very sensitive to poison ivy, rust tox is awesome. There's also histanum. We use Antranex to help dry up, crud in your sinuses and your ears. All that stuff is great. Stinging nettle, by the way, that's an herb you can get, and it also helps to decrease inflammation. Now, so you know that I like natural things. I do. But you know what? I gotta tell you something. If I put somebody on Antranex to dry up their ears and all this kind of stuff, it works really well. It's great for kids. But it also has a side effect, right? It's drying. So you have to drink tons of water because you will just be wrinkled like a prune if you take this stuff ongoingly and you don't take care of your body. So again, remember, just because it's natural doesn't mean it doesn't have a side effect. And so you got to be careful. So make sure you talk to your providers about all this stuff. Don't go and buy all these things and then make yourself sick. Now, here's a more causative thing. I love this. I just read about this. Check this out. This is cool. 2 things that we know that can help allergies have nothing to do with decreasing histamine at all. Not even a little. Check this out. 2 things. Calcium and hydrochloric acid. Okay. These are gentle tools that help with all kinds of allergies, including, by the way, the ones that are in the air. And so the patient might say, well, I had my blood test done and they checked my electrolytes and, my calcium's good. I don't need to take any calcium. Well, yes and no. So you might not be deficient, or you actually might be and not know about it, because the body is masterful. It really is. And, even if your blood calcium is low, it might not even show up, because what does the body do when the blood calcium is low? It brings it out of the bone to balance your calcium, to balance your blood calcium. So it might not be until way down the road that your calcium starts to be deficient and you see it in osteopenia or osteoporosis. Okay, so blood test or not, this is important. Now, I was tickled when I actually read about this, because I'm going to tell you something I did. This is kind of cool. My son once got hold of something that contained nuts, and he started having a very severe reaction. Scary. Let me tell you something. Really scary. God bless all these moms out here whose kids have severe allergies. We all need to go to the Bahamas together. I'm not kidding you. It is very stressful. Anyway, so my son had a severe reaction, and I started testing him using kinesiology methods, and I come up with a need for calcium. And I'm sitting there at home going, oh my gosh, I actually didn't have any at the time. That he could take. He was little, and he couldn't swallow pills. So I thought, what can I give him that's going to help him? So I went into my cabinet and I got Tums. I know, Tums are terrible. They are. I know. I know. It's not great calcium, but it is calcium. And I gave it to him, and I gave him a bunch of it, and guess what? It started to quell the allergic response. Not to, by the way, the exclusion of other drugs. Relax. We did give him Benadryl and other things, but what we wanted to try and do is to help support his body so the reaction would be not as intense. When we look for this calcium imbalance in applied kinesiology, it is very common to find bilaterally weak pectoral muscles when there is a deficiency in hydrochloric acid. And those two, are connected, the calcium and the hydrochloric acid. So give me just a second. So if you have a deficiency in hydrochloric acid, which is the acid your stomach uses, right, to break down your food, you suddenly have problems breaking down all kinds of things. B vitamins, calcium, right? All these things that actually go in through the stomach. Interesting. So then the body is out of balance again. You have food that is now non-sterile going into the small intestine with not enough acid content, and the small intestine's enzyme systems don't function the way they're supposed to. So you have all this yucky food going through your small intestine and creating more inflammation and more autoimmune responsiveness. So if you increase your hydrochloric acid by taking, quite frankly, a hydrochloric acid supplement when you eat only, because otherwise heartburn is a thing. Okay, so with your food, it will help you to maintain your calcium and to suppress histamine in a normal way. Now, if you're pregnant out there and you're listening to me, don't take the hydrochloric acid, really, because you will get a rockin' case of heartburn. So if you're pregnant, don't take HCl. I'm going to tell you what you should take. Go to the ABC store, where they sell liquor and stuff, or even go to your grocery store and get a little bottle of Angostura bitters. My mother had one bottle that lasted us like 15 years. I'm not kidding you. So it's about that big. It's a little bitty bottle. It contains berberine in it, and it's going to help your stomach to make its own hydrochloric acid, and it's not going to overwhelm you, the sphincters, and give you heartburn. So, but for everybody else who doesn't have, big problems and big GERD problems, hydrochloric acid is actually going to be your friend here. Next. Let's talk about another natural substance your body needs to work, and that is cortisol. In the last, 15 years or so, adrenals is the big buzzword. Everybody heard of adrenals? Oh, my adrenals are out. My adrenals are tired. Everybody's into their adrenals. Well, they're probably right, actually. The Chinese call it kidney qi deficiency, when you've been burning the candle at 7 ends and you're tired. Well, that's what we refer to as adrenal fatigue. And by the way, they knew about this like 2,000 years ago. We're only now catching up. So you can have burned out adrenals because you're stressed, because you have crummy eating, because you are not sleeping properly, you are not keeping to a proper bedtime, because you have emotional stress, because you've had an infection, because you have diabetes. I mean, you can have all kinds of reasons for the adrenals being off. But if you know that when your particular allergy arises and those corticosteroids or prednisone and things like that help and you feel better, there's a good possibility, not 100%, relax, but there's a good possibility that you may need some adrenal help. So what do we do to do safe adrenal help? Well, you can take raw glandular adrenal. You can get that in the health food store. I don't recommend everybody starts with that because that stuff is like a cannon, and I like to start with a pea shooter. If we can just help the body build its own adrenals up, that makes me feel better. But if somebody is really exhausted and they cannot heal properly without assistance, you can use raw glandular adrenal. I also like to use adaptogenic herbs like ginseng, maybe ashwagandha, except don't use ashwagandha if you've got autoimmune diseases. Don't do that because it's a nightshade, and I'm here to tell you if you have rheumatoid arthritis, Reiter syndrome, rheumatoid arthritis, all this stuff, you might feel really bad taking ashwagandha. But there are lots of wonderful adaptogens in Chinese medicine, and we should take advantage of that. Also, lots of B vitamins. My good buddy, Dr. Bruce Rind, who practices in Gaithersburg now, he's a medical doctor who practices alternative and complementary medicine. He has a phenomenal product called Basic Cell Energy, which is the bomb. It is like a B-complex cannon, along with some adaptogens that really helps a lot. I don't give that to everybody in my practice. It's for people who are truly fatigued. Another thing, salt. We give salt such a bad name. You must lower the salt in your diet. Don't consume any extra salt. But the truth is we need salt. We have salt in every single one of our cells, right? Use it responsibly. Use it liberally. Why? Because the salt helps support cortisol function. It also helps you hold on to your hydration. And you know what? If you put a little scoop of ascorbic acid in there, as long as you don't have a raging rheumatoid arthritis or psoriatic arthritis or something like that, you put a scoop of vitamin C in there, that's also going to help lift the adrenals up, right? We also know, by the way, that this sodium chloride is very good for asthmatics. That extra sodium that goes toward the lungs, toward the bronchi, actually helps with the bronchospasm. Cool stuff. Really cool stuff. Another thing, which I should have put first on my list, I don't know why I didn't, but is hydration. Hydration, drink water. If I give anybody recommendations over the week, the most frequent one by far is water. We get busy, we sit all the time, we don't want to drink water because we got carpool. Am I right, people in Virginia? We got carpool. And you don't want to drink water because you might, have to use the bathroom. But you got to drink water. So do it when you're at home in the morning or home in the evening, but drink water because that's what helps flush out toxicity, decrease inflammation, it makes your brain work better, all that stuff. Let's see. Dr. Wiseman, she's my bud. She's having a comment here about getting adjusted and helping her her allergies. It's really great. Okay, another thing, another way to help support your autoimmune system is blood sugar support. What do I mean by blood sugar? I mean constant, even blood sugar. Not too much insulin, not too much sugar in the blood, but somewhere right in the middle. Why? Because it'll make you feel better if you actually keep it stable. When you don't eat enough during the day or the right kinds of foods, you can develop something quite easily called dysglycemia. And by the way, it's not just all of you who drink an extra beer and eat a little, candy and all this other stuff. I see this in kids. I had a third grader in my office today who blows up like a volcano at her family when she comes home from school because her blood sugar is that low. It makes her cranky and angry. And you know what? Mom, every day from now on, I know is going to have like a burrito or some jerky or something that she's going to give this kid because blood sugar is king. It influences the cortisol pathway. That influences your inflammation. You must have your blood sugar balanced. Dr. Viktor Frankl, may he rest in peace, the creator of total body modification, said there are three things: structural correction of the ribs, hydration, and blood sugar. So true. How do you know if you have a problem with your blood sugar? You can have any of these symptoms. You ready? Sweating, especially in the back of your neck at your hairline. Morning headaches, like you just don't want to eat in the morning, you feel yucky, and that's when I tell people, but you have to eat because your blood sugar's low. Yeah, but I don't feel like, I'm like, look, I don't care. Have it as a shake, have something. You got to eat in the morning. Nervousness, shakiness, feeling weak, nauseous, having dizziness, headache, having trouble just concentrating on what you got to do, even slurred speech, feeling unsteady when you're walking, muscle twitches, change in personality like we just talked about. All of these things are related very potentially to your blood sugar. So how do you correct it? Well, my first go-to is the Sugar Control Program, which is also now called the Autonomic Recovery Program, created by Dr. Viktor Frankl. Atkins is a perfectly good way to do it. You can read the Sugar Control Bible by the great and late Dr. Jacqueline Paltis. You can look at paleo diets, basically reducing the fine carbohydrates, eating slower burning foods, and eating more often is going to get you much of the way there with reducing your inflammation and your allergic responses. Also, with all the good food, you must populate your small intestine. There's that saying, it says like, how do you outnumber the heathens? By outnumbering them. Well, that's what you got to do with your gut. You have to put probiotics down there and prebiotics down there so that when all that good food comes down there, that the body can assimilate it without making an inflammatory mess in your whole body. Because if you don't take good care of your intestinal system, what we know happens is it becomes more porous, meaning the holes become much larger, and food that's way too big sneaks out of the lumen of the gut and goes into the bloodstream, and then you get all kinds of funky autoimmune diseases, arthritides, and other things. So it's extremely important to take care of what my friend Dr. Wiseman is really quoting a lot right now, your microbiome, looking at this living world in your gut. Okay, in addition, to help balance your blood sugar, reduce your inflammation, and make you more even in all ways, is sleep. Nobody needs to be looking at Facebook at 2 o'clock in the morning, ladies. Seriously, wait for later in the day. If you want to be healthier, you have got to sleep, my friends. All you have to do, this is how easy it is. I'm not kidding you. All you have to do is find the time you want to go to bed and keep it, and go to bed within an hour of that time every night, and wake up at the same time every morning, assuming you get at least 8 hours of sleep, even on the weekends. What? Yeah, really, even on the weekends. The more consistent you are with this, the better you're going to feel, the better your blood sugar is going to hold, the more rested you're going to be, and the better your body can heal at night. Remember making your own cortisol? That's the deal, right? Okay, so that is another strategy. So we looked at mental, mind-body health. We looked at nutrition, calcium, hydrochloric acid, sodium, vitamin C, B vitamins, homeopathy, herbal forms of histamine blocking or mast cell inhibition. We looked at conventional meds. Let me tell you something. If you're having an emergency, nothing quite like a Benadryl. Amen. But we try not to have to use it, right? And we also talked about the care of the nervous system. Because without that, nothing else works. So chiropractic adjusting in whatever way works for you. By hand, by instrument, with tables, low force, vigorous force. It doesn't matter what kind, as long as it goes to the specificity of the subluxation at the specific level, it's corrected, and you can show before and after that you fixed it. Ooh, and hydration. Sorry, drink your water. All right. I just talked my head off for all this time, and I'm going to chill for a second. I want to know if you have any questions. Seriously, this is your opportunity, everybody. I want to thank you so much for listening and joining me and giving me all of your questions and all of your encouragement. I was a little nervous, I have to tell you. I really like speaking, but I was a little afraid because this is like in front of the universe on Facebook. And So I want to tell you how much I appreciate it. So are there any questions? Any questions? Thank you, Dr. Schitwell, for your encouragement this evening. Thank you, Mrs. Ballinger, for your encouragement this evening. Anybody? Question about allergies, chiropractic and allergies? Anything else? Thank you, Mrs. Chasen. Oh, I want to give you one more piece. I can't believe I forgot this. Hold up. This is a very conventional recommendation. It's really important. Check this out. So we have a ton of pollen in the air. I was sitting with Mrs. Howell in my dining room, and she was like, oh my gosh, Erica, your tree is like snowing. And all this pollen was going whoo and falling off. Okay, we all like to have open windows and fresh air in the spring and all this stuff, except if you have allergies, because then it's horrible. If you have allergies, close your windows, turn on your air conditioning, make sure your filters are clean. When you go outside, wear a hat. This thing right here, the schmata on my head, protects me from all kinds of pollen, right? When you come inside, take the hat off. Don't wear it around the house. Make sure you wear a jacket on top of your clothes that catches all the pollen, and then take it off when you come inside. Always shower in the evening. Don't get into your bed if you've got pollen and dust and grass and all kinds of stuff on you, because it's going to get all over your pillow and your sheets and all that stuff. Shower often. Your kids too, and the dog also, because they bring it in too. They go past all these bushes and things. So clean everything. Change your pillowcase much more often, every day or two, really. These are conventional suggestions, but they work. In addition to taking the load off internally, also take the load off externally, and you'll feel a whole lot better. Thank you, Ms. Moncure, for your encouragement. Love to y'all. Mrs. Boyette as well. Thank you for your service. We appreciate you very much. What else? Any last thing before I say good night? We're going to give you a couple more seconds. I'm watching. Okay. So once again, thank you everybody for tuning into this class. I really appreciate it. This is going to be saved on Facebook, and I invite you to watch it again if you found it was helpful and didn't catch some of the details. Please feel free to email me with any of your questions. My email address is dr.erica@maimonideschiropractic.com. You can also call us at the office. Letitia can't wait to talk to you. Her phone number is 703-383-1630, and we can talk on the phone. We can talk on Skype. Clearly, I love to talk, right? So if you want to be in touch with me, please call, please Skype me, email me. No problem. Also, what else? This is going to be archived. You can listen to it at a later time. Please, if you have somebody who's really suffering with allergies out there, share this with them, okay? Even if they're in Illinois or Kansas and somewhere, they're never going to come see me. It doesn't matter. Give them the information, because, if you give a man a fish every day, you'll feed him for a day, right? But if you teach him how to fish, he'll be able to eat for a lifetime. So we'll remember the Rambam's great words, the Maimonides words, and I thank you, and have an awesome night, and God bless to all of you. Good night.